All right, to begin, I'm gonna wash my hands for 30 seconds. I'm gonna turn on the water, get some soap. All of my jewelry has already been removed. Just washing my wrists, the backs of my hands, front of my hands, between my fingers, the creases, fingernails. All right, 28, 29, 30. So I'm gonna rinse here, grab my paper towel, turn off my water, dispose of my paper towel. Next, I'm gonna make sure my sterile field is assembled here, which everything is assembled thus far. I'm going to open up my sterile field now. I'm going to pinch one corner here, let it fall open, and then I will pinch the other corner, not touching any other place on the sterile field. Remembering that now this outer 1 inch of the sterile field is considered non-sterile. Now that our sterile field is open and assembled, I'm going to don my hair cover, making sure all of my hair is tucked in here. Next, I'm going to put on my mask. The patient I'm treating is on droplet precaution, so that's why I'm using this type of mask. If my patient was airborne precaution, then I would use an N95. Just pinching my nose here to get it fitted around my nose. Next, what I would do is if I had a face shield, this is when you would put on your face shield, unvelcro it, put it on, and velcro it. All right, next I'm going to open my gloves here, well, the outer package of the gloves, using 2 fingers. I'm going to open this. And then I'm just going to let it slide out here onto my sterile field. In the middle, there we go. And then dispose of this in the garbage. From there, now I'm going to wash my hands for 3 minutes. Normally it would be 7 minutes, but for the sake of this practical, we are doing 3 minutes. So I will turn on the water. I'm gonna go ahead and open my sponge. Got a fingernail side as well. Came with a part to wash my cuticles as well. So I'm gonna go ahead and turn on my water, get my soap. I'm just gonna go ahead and start brushing here. We need to go to 3 inches above the elbow for a sterile procedure. On both sides here. Make sure we're getting in all the creases. Getting in between my fingers here. Getting in all of those creases there, my fingers and hand. Getting my fingernails here. Then before I rinse, I'm just going to get my cuticles as well. All right, 258, 259, 3 minutes. So what I'm going to do to rinse is I'm going to rinse from the top down and let the water come off of my elbows here. And since it is not a foot pedal, it's a normal sink, I'm going to wipe my hands off with a clean paper towel, then use that to turn off the sink and dispose of it in the trash can. Now I'm going to keep my hands here in this square between my shoulders and my hips. Alright, next I'm going to don my gown. I'm going to use just a pinch here in the middle and open it up here, not letting it touch anything. And I'll go ahead and stick one arm in without letting my hand come out. And then I will stick my other arm in without letting my hand come out. Now I'll have my assistant come tie my neck strings. Alright, and now I will use the closed glove technique to don my gloves. I'll open the package. Alright, now I will use my left hand and pinch the top right part of the glove. Let my hands out a little bit. And slide the glove on. Next, I will slide 2 fingers through the cuff here. Let this hand out slightly and don this left glove. Now I will fixate it around. Make sure that it is around my gown here. And next, I will have my assistant come tie my waist strings. Alright, now I'm ready to complete my sterile procedure, keeping in mind that the outer 1 inch is considered not sterile, and with anything contaminated needs to be disposed of properly in a trash can or in the biohazard bin. Now that our procedure is finished, we will go ahead and dispose of the sterile field here. So I'm just going to go ahead and wrap it up here. Fold it up into pieces and dispose of it in a red biohazard bag. Next, I will doff my waist string. Then I will doff my neck string here. I will give myself a hug and I will fold it inside out here, rolling it and keeping it all contained on the inside. And dispose of it in the red biohazard bag. Now I'm going to take off my gloves using the open glove technique, using my left hand, pinch my right palm here, take the glove off, using my right hand, my right finger on my right hand, under the left glove here, dispose of that properly. Now I will wash my hands for 30 seconds, turn on the faucet, get some soap, getting my wrists, on some backs of hands, in between fingers, creases, fingernails. 28, 29, 30. I'm going to rinse. Dry off my hands with a paper towel. Use the paper towel to turn off the faucet. Dispose of that properly. Next, I'm going to take off my face shield. It's a disposable one, so I'm going to dispose of that. Next, I'm going to take off my face mask. Trying to only touch the tie there. Dispose that properly. Take off my hair cap here. Dispose of that properly. Lastly, I'm going to wash my hands again for 30 seconds. Turn on the faucet, get some soap. Again, getting the wrists. Fronts and backs of hands, in between the fingers, creases, fingernails. 28, 29, 30. Now I'm going to rinse. Wipe my hands off with the paper towel and turn off the faucet with the paper towel.